Hey folks, this is Sevtap Savaş and this is our conversation. I had some personal health issues to deal with since last time, so my apologies, but I'm back and I can walk. As you can see, my ankle is feeling a lot better. It's a beautiful May day in St. John's, Newfoundland and Labrador, and we will continue to talk about cancer, how we can protect, how we can be informed about it, and how can we help ourselves and our loved ones, including family members, friends, and community members. So today I want to talk to you about family history of cancer. We get a lot of questions about when somebody should be concerned about the cancer, which is due to genetic or inherited factors. These are the factors or changes or characteristics in our DNA that exist in almost all of our cells. Sometimes they include some sort of abnormalities that may increase our risk for cancer substantially. And you may know some of those, for example, breast and ovarian cancer. Yes, breast cancer is very common. 1 in 10 women are expected to be diagnosed with breast cancer, if I remember correctly. But in some cases, it's familial or hereditary, which means that some individuals have a much more increased risk to develop breast or ovarian or breast and ovarian cancer together. So how do we know that because cancer is also very common. Remember, 4 in 10 individuals will be organisms diagnosed with cancer. So it's such a common disease. How do we know whether there is an indication for familial or hereditary cancers or not? This information can be important for estimating your own risk. For example, is it the population level risk that, like anyone else, let's say your developing breast cancer can be 1 in 10, or is it a familial which would increase your risk to sometimes up to 80%? Right, the lifetime risk of developing breast or ovarian cancer. So this information can be like whether or not it's a familial or hereditary cancer. This may really be helpful in informing you about your risk of developing cancer and what you should or you could do with this information. Right? So here's the thing. We all know about the possibly familial health history. It's really important to know that, but sometimes I understand people are not open about their health problems, so that's okay. But it can be really helpful to know the health conditions that affect both sides of your family members, both from your mom and from your dad side. And then there are a couple of things that we look at, and clinicians also look at, is which type of cancer, what is the age of diagnosis, and whether there are multiple individuals affected by the same cancers. So, and there may be other factors accounted for as well. So all of this information eventually can help estimate your cancer risk. And there is no simple answer, as you can see. So the best thing is to talk to your family physician or nurse practitioner. My PhD student, she reminded me that I should include nurse practitioners as primary healthcare providers in my activities. Yes, Krista, here you go. What do you do? So try to collect this information as much as possible without, in a way that is comfortable for you and other family members, and communicate this to your primary physician or nurse practitioner, and ask about your cancer risk and what you can do with this risk, right? So there are a number of things you can do as well, and we will talk about them later. But right now, what I'm trying to do is to help you understand your family history. And this is for cancer, but for other cancer or other diseases as well, like heart disease. I have a family history of heart disease, so my family doctor is close to following me. But for cancer as well, it's really important, again, to know your family history from both sides of the family, from both moms and dad's side, as much as possible. and then communicate this to, your family doctor or nurse practitioner. He or she can ask you about, the number of individuals affected, types of cancers, and age of diagnosis. And one thing I want to say is that if it's hereditary, we usually see certain cancers diagnosed early, but we will talk about this later. So please think about these: importance of family history, communicating this to your primary healthcare provider, and then identifying your risk and what to do with this risk. We will talk about what to do with this later. Until next time, folks, take care.